Secretary, good to be with you. A couple of quick topics. First, the most significant issue that our Rhode Island hospitals are facing right now is nursing and healthcare workforce. And this has two dimensions. One, they're unable to operate at full capacity and are having to stop procedures because they simply don't have the workforce to operate. And second, because of the, I would call it a plague of contract nursing, they're having to spend spectacular amounts of money for services that didn't cost anywhere near as much before. What are you doing to help hospitals who are facing these twin pressures? Should there be some form of special reimbursement for the added nursing costs so we can get them back on their feet again?
Well, one of the principal tools that we've used for some 440,000 providers throughout the country is to provide them with reimbursement of some of their claims relating to COVID. That Provider Relief Fund, which you and your colleagues helped put in place, $186 billion worth, has helped us provide substantial support to some of these facilities who are suffering from some of these conditions. Unfortunately,
they kind of burned through that, so now and the problem is still there.
It makes it tough because...
Would you mind following up with treat that as a question for the record and let me know what...
Of course. We look forward to working with you
planned.
We need authorities and resources to continue to help some of those providers.
With respect to support for people who have addictions, we've always done prevention. We've always done treatment. It was only through CARA that we started providing recovery support. Yes. And because it had never been done before, we're kind of in a stranger in a strange land with no real guideposts as to what works and what doesn't work. Are you comfortable with the degree of flexibility that you've allowed for the recovery services to let people find their way, since there isn't a huge track record of success and data because we've never funded this before?
Senator, you touched on something very important, the data, the evidence. And usually at the federal level, we're the last to try to move in a direction that could help save a life or keep someone in better health. But what we've done with our new strategy on drug use is move away from the old paradigms. We are letting go of some of those taboos. We're looking at the evidence. And so, for example, fentanyl strips. Some people say if you give people access to a fentanyl strip that lets you determine whether the drug you're about to take has fentanyl in it, which has caused some of the largest number of drug overdoses that we've seen, not suicides. That helps promote drug use. We think it helps promote saving of a life. The evidence shows it. So we're going to go in that direction. Clearly, we're going to try to help those who are moving in a faster direction to help treat.
Yeah.
But we're also going to...
My point is, I think it's important to be flexible with the recovery stuff because people are having to kind of learn while doing and report in. And later on, when there's a body of research that shows what works and what doesn't work, then I think you can narrow the aperture a little bit. But right now, I hope you continue to provide support because we just have, it's always been underfunded before.
We're moving as best we can.
Last point, you focus in the budget on what you call program integrity
voted on the second one
efforts, which have been around for a long, long time. I was the U.S. Attorney in Rhode Island, and Attorney General Reno put healthcare fraud and program integrity at the top of her policy priorities. And it's been at the top of policy priorities for a long, long time. And I worry that there's just not a whole lot of there because it's been focused on for so long. And once you actually get into the cases, they're hard to make. Yeah. So I think putting that as a priority with respect to lowering healthcare costs is a strategic mistake compared to focusing on delivery system reform, trying to get away from fee-for-service, trying to expand ACOs, trying to make sure that quality metrics are in place across the system. I think that probably fee-for-service is the biggest monster that is driving healthcare costs right now. We talked a lot during the Obama administration about the triple aim, and I would urge you to go back to that. In this committee, even when we were in our most highest level of Obamacare hostilities, the parts of that bill that related to delivery system reform, the ACOs, CMMI, payment reform, those things have been very popular, and there's been a lot of success across the country with actual cost savings. So I would encourage you, particularly as we close in on a period when Medicare might get like cash negative, to really make that a focus. I think you may find that program integrity is a bit chimerical as a savings device.
Senator, we agree with you that delivery reform is absolutely important, and we are working on that. But let me just persuade you that we can walk and chew gum. As a former Attorney General in the state of California, we did work on program integrity. There is abundant fraud out there, and we can tackle it. And if we don't, then those who are doing it think they can get away with it, and will do more. And so I think we can walk and chew gum and do both areas of reform.
I thank my colleague. Senator Portman is next, and he is online.